50 years ago, a vision was born to bring quality healthcare to the heart of rural Missouri. Today, we celebrate the journey of Missouri Highlands Health Care, a story of service, resilience, and growth. As a nonprofit community health center, Missouri Highlands Health Care endeavors to meet the primary and preventative health care needs of the residents of Carter, Reynolds, Shannon, Iron, Ripley, Butler, and Wayne counties in Missouri. We are committed to providing high-quality, cost-effective care and services to all patients, regardless of payer or ability to pay. Our emphasis remains on providing health care to all patients in our region as we support programs to improve the health status and healthy behaviors of our communities and patients. Missouri Highlands Health Care strives to ensure its long-term fiscal solvency and desires to remain an employer of choice in the area. Missouri Highlands began in 1975 thanks to the dedication of Virgil Norris, then mayor of Van Buren, alongside Jack Klingon, who served as the first CEO, and a group of passionate individuals who believe that everyone deserves access to healthcare, no matter where they live. Our first clinic in Van Buren opened its doors in April 1980, setting the stage for decades of growth and care. From Van Buren in 1980 to our newest partnerships with Poplar Bluff School Districts to provide in-school care, we've expanded to over 20 clinics meeting the needs of patients across our region. Our growth and success wouldn't have been possible without the leadership of the CEOs and board members whose vision and dedication guided us. Missouri Highlands CEOs have included the founders, Jack and Joyce Klingon, Alan Freeman, Cheryl Lynn Clark, and myself, Karen White. Through the decades, the role has evolved as healthcare delivery has changed and as hospitals in the area have closed. Over the years, we've introduced programs like the mobile delivery of care in dental, medical, and substance use disorder treatment, taking healthcare to the patients in our rural areas. We have been instrumental in ensuring the continuation of maternal health in the region, as well as expanding our pediatric services to include school-based care in Butler and Ripley counties. Becoming a patient-centered health home through the National Council of Quality Assurance and maintaining that designation for over a decade has been a milestone moment. Daily, the expanding role of our community health workers touch the lives of countless individuals in our community through their focus on determinants of health outside the clinic walls. This journey would not have been possible without the trust and support of our patients, alongside our partners who have stood by us every step of the way. As we celebrate 50 years, we look ahead with renewed commitment to providing compassionate care and ensuring the health of our communities for generations to come. Thank you for being part of our story. Together, we've built something truly extraordinary, and the best is yet to come.
I've been on the board for 20 plus years, and it was a very small organization when I first got on the board, and it was very localized to mostly this community. And then over the years, with different leadership and different opportunities, we have expanded to many other communities where the need has been great. Well, the expansion of Missouri Highlands over the years has given us the opportunity to serve a much greater need in our communities through a variety of ways, from our primary health care, which is where we started and which is kind of our gold standard of who we are, and then eventually into the dental field, which really helps us from a financial standpoint and also fitting a need that no one else in any of our communities is providing. And then we, of course, have gone into the mental health field, where there is such a significant need in the nation, and that's something we're providing at the local level, maybe not one-on-one, face-to-face, but through telehealth and technology, we're able to provide that in ways that we never dreamed that we could provide that in the past. So We are still doing that and still expanding our services in all the communities that we serve. In fact, many of the communities, like this community, we are the only healthcare service actually in this county.
I started working with the Missouri Primary Care Association in 1999, doing strategic planning with the board of directors. I started working up here around 2000. Karen and her team are really working hard to fill the needs of all of their service areas. And so that's going to continue to be a challenge as more hospitals close, as money becomes tighter, and the kind of business plan that it's going to take to be sustainable is probably going to change dramatically over the next decade or so. 50 years is pretty phenomenal for a health center to be doing what's going on here. That's one point. The second point is that, you know, it takes a whole bunch of people, an understanding board of directors, good leadership, folks that are really interested in serving the population at the service delivery level. Missouri Highlands has all that. They have all of that. And even moving towards integrating primary care with behavioral health and dental care, and then adding the community health workers to do the care coordination outside of the facility around the social determinants of health with a focus on population health is very forward. It's very forward. And I just am really, really excited for the people that live here to have that kind of thinking and leadership and commitment to providing access to health care.
When I first started, I believe they had about 4 medical clinics. We now have 14 medical clinics. We had 1 dental clinic. We now have 3 with 1 in the works. They've gone to behavioral health. We didn't have any of that kind of stuff. They now employ CHWs. We get a lot of grant things where we can actually help the people outside of the clinics to do things. So it's growing by leaps and bounds, and it doesn't seem to have stopped. So it's very nice. We now have a fleet of vehicles, and when I first started, you took your own car because I was a float nurse, and you didn't have a car to drive. You just took your own. So now they have things like that. It has really made a significant difference.
Missouri Highlands is a family, and working for Missouri Highlands and being able to help take care of patients, you know, even in IT, you still are taking care of patients. So, you know, patients is definitely #1 priority, I think, for our staff, and just being able to help the communities, especially the smaller ones that really, really appreciate Missouri Highlands being in them. That is what makes us happy.
Yep.
So I started working with Missouri Highlands almost 13 years ago, and I originally really wanted to work somewhere close to home. And I had practiced as a registered nurse at a facility about 85 miles away. And then when I became a nurse practitioner again, the next job I had was 85 miles away. So when I was able to work and live in the same county, I was just tickled to death to be there. Patient care, when I first started, we really had a nurse, a provider, and a receptionist or patient service representative. And at this point, we have so many other services available. We have community health workers, we have a lot more counselors. We just have so many other services that we can provide patients with. And we still have the grants that we had there, as well as other benefits that our patients have that are available to them now. We have a slide fee. We have grants that help cover medications. So as far as that goes, bringing that access to care is incredible with Missouri Highlands. I think our support staff that we have access to, such as community health workers, can give an example of that. I had a patient who needed to follow up on their test, and we were having trouble getting in touch with them. There are a lot of folks that run out of minutes on their cell phone, can't reach them. Community health care worker went to the patient's house and was able to visit with them and get their appointment rescheduled. And those are things that I could never do as a provider. That person could have been lost to care, but because of those support services that we have, she's back in care. I love to help people. The rewards are that you see people that are happy, they trust you, they come back, and they have a successful healthcare life, you know. And that to me is the reward of any healthcare provider should be, is that, you know, a person is healthy, and they trust you to get the care that they need. Of course, you have difficulties, and not everybody will make it, but nonetheless, you're there to support them with all the needs, all the supports that we can possibly give.
Each year, we usually will treat over 1,000 students just on our mobile dental outreach alone. A lot of those students that receive care while we're at their facilities wouldn't otherwise get dental care. So being a part of this community and being able to reach our family and friends like that is very rewarding. So I think that Missouri Highlands Dental is doing a really great job to meet their community where they are in regards to their dental needs. However, I think we can do even more, and I'm encouraged by the leadership within our organization, the grit and determination and the heart that they have for each of the communities that we serve. So I believe we're really just getting started. There's so much more to come as far as impacting our communities and meeting their needs. Generally speaking, I'm just really grateful for the opportunities that I've had with Missouri Highlands and the opportunities that they create for our communities. It's something that I'm really proud to be a part of.
Missouri Highlands Health Care celebrating 50 years. That's quite an accomplishment. In today's world, things change constantly, and they've kept up with those changes and worked on providing different services, provide them in unique ways. We should be very thankful and celebrate this half century of Missouri Highlands, and can't wait to see what the future years bring for Missouri Highlands Health Care and the families of our region.
During the time that I have been at Missouri Highlands, first as their Chief Financial Officer starting in 2009, and then transitioning to the CEO role in 2014, healthcare has changed significantly during that time. Missouri Highlands is not the same healthcare provider it was when I started back in 2009. We have expanded our role in primary care to be more inclusive, listening more to what our communities need from us, whether that is to be more involved in our school-based clinics, which is probably one of the things I am most proud of. Just being able to really serve the most vulnerable of populations with our school-based care is probably one of the biggest milestones, probably one of the biggest achievements, I will say, over the course of my tenure here. That really just brings such a smile to my face, to be able to walk into schools and see our care professionals just treating the kids, getting to know the kids, is huge for me. I've often said that Missouri Highlands really should be a pipeline for folks to go and just try on a career in healthcare, to be able to interact with those of us who have chosen Missouri Highlands as our employer, our mission, our passion. And I think that's very evident in our school-based programs, because you do see kids just kind of go like, wow, hey, I could do this. I could be a physician. I could be a dentist. I could be a nurse practitioner, a nurse. I could be a clinic manager. And they're getting to know one-on-one what that side of life looks like, and really getting to know us just as people. Missouri Highlands, over the course of the 50 years that we have been here, has evolved from basically being the free clinic. It's where people went when they had no place else to go. And now we are more the choice of healthcare throughout the region. When I started in 2009, we had 7 clinics. Now we're up over 20. And again, just expanding to be
The access choice for folks, that is so key, I think, moving forward, is just being very responsive to what our communities needed and ask of us, and being able to say, yes, we can do this. That is exciting to me. The challenges that they were facing at the time just really got to me. I didn't know who Missouri Highlands was. I didn't know what an FQHC was, just a bunch of letters. I knew, I knew as much as anyone about healthcare, but it really never struck me what an impact Missouri Highlands made at that time and would make up until, up to now, right? The overall impact we've had on folks. But the challenges were there. Providing care in the middle of nowhere is always a challenge. The lack of financial stability has just unfortunately been the story that I tell. No matter how hard we try, there are always forces against us. The workforce challenges that exist in rural, they were bad 15 years ago. Are they worse now? They seem like it, but they probably aren't. It's just that we have to find different solutions. Starting earlier, I always say, let's start with elementary kids. Let's start engaging them around workforce issues. Let's see what they want to be when they grow up. Let's expose them. Recruitment of providers, any healthcare providers, any healthcare professionals into a rural area is always a challenge. While we can all love and appreciate where we live, it is hard for folks that have never lived in rural to imagine what a life looks like here. And so being able to expose folks to that, I think, is key in finding solutions around that. Gosh, there's probably 1,000 other challenges that I could go on and on about. But overall, we stay focused on the patients. We stay focused on our purpose, our mission, our reasons why we get up every day and do that. And to do this, you have to always stay focused on the why. And the why continues to be the people that we impact every single day. And I just feel like Missouri Highlands is well placed as we are delivering care to our family, friends, and neighbors, that we can also say, hey, what else can we be doing? It's those what ifs, those dreams that really keep me excited and engaged and looking forward to the future. Over the course of the next 50 years, I think we will see multiple changes in healthcare, from how healthcare is being delivered to advances in technology, to advances in medicine. I think healthcare will become more personalized as it evolves. It feels like we go back a few decades to the town doc going and doing home visits, right? I think we'll see something very similar become the norm, only the doc will be visiting you on your telephone, on your smartphone, and that care and monitoring of chronic conditions will become more home-based, more patient-driven, giving patients the ability to determine their own outcomes around what their care plans look like, what interventions are utilized, things like that. That's where I see technology going. That's where I see healthcare going. I think we'll also see a lot around payment models for services. What will healthcare look like? And I really think that Missouri Highlands will continue to always be at the forefront of saying yes to initiatives, saying yes to pilot programs, saying yes to whatever is needed to improve the health and well-being of our population. I think we will still be focused
on caring for our friends and our family and our neighbors, because that's what we do. That's why we're here.